Hi, have you had a good summer? I've had a crazy one, and I'm here today just to sit down and tell my story. There's a few reasons why I want to do this. I think it can be really awesome for helping people know that they're not alone, and I don't know, just giving like a realistic story about pregnancy and birth because it's not all the glamour that you always just see on TikTok reels. I think it can be something that helps you guys get to know me better and just give you guys a little peek into one of the biggest events of my entire life so far. But honestly, mainly, I really just want to do this for myself because, in a lot of ways, I think it can be very healing and therapeutic to just sit down and recount my story and tell it to someone. And I know in reality, I'm sitting here just telling my story to a camera in an empty room. I mean, my dog is here. I talk to her all the time, but there's just something healing for me about being vulnerable and human and just sharing my perspective with the world. I don't really care if nobody cares or if nobody listens. It's something that I'm just wanting to do for me. And if it helps someone along the way, whether that's to encourage them, help them feel like they have a friend, or if you guys are just nosy and interested in the details of my life, cool. Then I hope you enjoy listening to this because it's going to be a pretty long one. I have quite a lot of things to say, and I want to take my time and make sure that I say the things that I need to say. That way, by the end of this, I feel lighter. I feel like I've done what I needed to do, and I've kind of just gotten all these things off my heart. So if you've randomly stumbled upon this video because the YouTube algorithm is weird sometimes, hi, I'm Em. I own a shop called Munimade.com, and I'm just really into all things crafty. I recently was pregnant, so I would say this has been my experience for the past year. This story takes place a year ago in September of 2022. And that is when I got pregnant. And my son is about 3 months old now. And so this story is going to take place over the course of a year. So that's a lot to cover and a lot to say. I do want to say that there will be some difficult topics in this video. So a little bit of a trigger warning. I'm going to talk about pregnancy. I'm going to talk about Hyperemesis Gravidarum. I'm going to talk about pregnancy depression and anxiety, postpartum depression and anxiety. I'm going to talk about an unplanned birth. So it was a month early, it was premature, it was unexpected. I'm going to talk about an unplanned C-section. I'm going to talk about our stay in the NICU, our stay in the hospital in general. And then finally, the postpartum phase and breastfeeding and bonding with your new baby. Those are all the things that I just want to talk about and express my experience with. So if any of those things, any of those topics bring up some difficult memories for you, or if it's something that you just don't think it's healthy for you to hear discussion about right now, then by all means, please put yourself first. Take care of yourself and don't listen to or watch anything that is going to harm you in any way. Hopefully my story can help you, encourage you. I don't know. I'm going to try to yes, I went through a lot of hard things, but on the other side of it, I'm a better person because of it. So I'm going to try to make sure that we always see the positive in things. And then on that note, I am going to divide this video into topics. So down at the bottom, you should see little titled sections of the video and timestamps in the description, so you can skip ahead if there is a specific portion of my story that you are not wanting to hear for whatever reason. Two things I would like to add before we get into it is I'm fully aware that some people go through more difficult things than I did. It's not a competition. My story is unique to me, as is everyone else's story when it comes to pregnancy and birth is unique to them. I'm incredibly grateful that me and my son did make it on the other side, and we're both happy and healthy. I am so grateful for the outcome, but in those moments, I didn't know what the outcome would be, and getting there was incredibly difficult for me, and me and him both had to overcome a lot. As my therapist put it, you can have two ways of thinking coexist with each other. You can be extremely grateful for everyone coming out okay, my son being healthy and making it out of the NICU, and me making it through my illness. We're really grateful, and we have a lot to celebrate for that. But I am also allowed at the same time to mourn the experiences that I had, and I'm allowed to be sad and experience pain from the trauma and the fear and everything that I went through. Those two things can coexist at the same time. So I just want to make that clear. It is not a trauma competition. I am not telling my story to compete with anyone on where it lines up in the sadness scale. That's not the goal here. The goal is just to tell my unique story, my unique experiences, and share how everything ended up. And yeah, we're really grateful everything ended up okay. And I know that that isn't the case for everyone. And I'm really sorry for that. I'm really sorry. But I'm also allowed to share my story also, even though the outcome was good. I have no interest in people trying to compete with my story and one up and tell me what's sadder. Secondly, I just want to make it super clear that I only made it through because of my support system. And so I would just like to thank my husband for being the best husband I could ever ask for, both of my parents for being really extremely helpful and accommodating in the hospital, and my brother. My brother went out of his way and above and beyond to bring us things to the hospital, come up there constantly. He was so kind to my son and is, and I just am really thankful for that. It is quite honestly the nicest my younger brother has ever been to me in my entire life when we were going through the situation. And so, of course, I'm really grateful for my whole support system. Even my grandma came up there and was visiting us. I am grateful for everybody that was involved, and I would not have made it through without those wonderful people. So I got pregnant a year ago in September 2022. I do have one other video on my channel just talking about my experience with the first trimester, so I might kind of repeat some things that I was feeling in that video. But essentially, the pregnancy was planned. It was wanted. Me and my husband really wanted to grow our family. We thought it was time due to our financial status, our age, our friend group. We just felt like we were in a great place to expand our family. So it was very much wanted. It was very much planned for, and we were very excited to start that journey. So when it happened for us, we were both just over the moon, thrilled. But immediately I noticed kind of like a heaviness, a fog, a brain blurriness just settle in. The best thing I can compare it to, if any of you have had COVID, there's a brain fog that a lot of people get, and that's kind of how I felt pretty immediately after getting pregnant. I can't really say how many weeks into pregnancy it happened, or, I can't think of a definitive day it started. I just know that pretty quickly I just lost interest in a lot of things. I didn't have energy. I just did not have the mental clarity that I had pre-pregnancy. And that was really strange for me. It was really unsettling because the biggest thing is that I lost interest in my crafty hobbies. And if you know me at all, you know that that's a huge part of my life. It's a huge part of my personality. It is what my job is based in. And so for me to lose that interest, that's pretty bizarre. And I felt that pretty immediately. I didn't have interest in crafting, crocheting, diamond painting. I just really didn't have interest in being creative. I just don't think I had the energy left over after spending the whole day working and just growing a fetus, I just didn't have the capacity left over to be creative. And I know that a lot of you might think like, oh, okay, September last year, isn't that when you started up doing diamond paintings with Munimade? And a lot has happened in my business since then. So it's kind of weird for me to say that I had a brain fog and I would say depression. I had a pretty bad depression settle in. And at the same time, there was a lot of big things happening with my business. And on the outside, it seems like I was, being pretty creative and productive. But I would just say that every bit of me, every ounce of energy I had went towards work, went towards my business, and then there was nothing else left over for me personally, for free time. There just was nothing left at the end of the day. I would collapse on the couch, scroll reels, and scroll social media and just be a potato. That's literally all I did. It was honestly a battle to even stay awake. And it was just this weird, like really heavy, really fast depression that happened to me. So I asked some of my friends about this, some people that I knew who had recently had babies. And I was like, is this like a normal pregnancy thing? Did you guys experience this? And they all said no. So I kind of just felt like a crazy person. I'm like, what's wrong with me? I really wanted this pregnancy. Obviously I'm like excited for what's to come, but why do I feel so depressed? What is the deal? Is there something in me that, honestly, I had thoughts of like, is there something in me that's incapable of being a mother? Do I just like not have that mother instinct? Do I just not have that excitement? There's something that just wasn't clicking. And there was a lot of thoughts that immediately went to what is inherently wrong with me? As to why I'm feeling this way, because I had never saw anyone else on the internet, or even when I talked to my personal friends, talk about just having this like brain fog, heaviness, depression just settle in. And honestly, at the beginning of pregnancy, I was counting my blessings. I was like, you know what? I'm not even sick. I'm not throwing up. I feel fine, except for mentally, and I feel tired. So honestly, I was just counting my blessings, and I was like, everything's going great so far. Well, then the physical illness settled in, and that kind of snuck up on me a bit. I wasn't sick and I didn't have morning sickness at the onset of pregnancy. It was something that kind of like built towards the later parts of the first trimester. And then it came to a peak in the second trimester. I started getting really nauseous all the time. I started having severe food aversions to where I just like was not interested in food whatsoever. I started vomiting all the time, everywhere. It was just really horrible. Throwing up at all is a horrible experience. And when you start to do that daily, multiple times a day, or even if you just spend your whole day feeling sick, it's pretty darn miserable. And I was already mentally not in the greatest of places. So it was discouraging. Honestly, it was super discouraging. And so I wish I was better about like writing down specific dates, but I don't remember the exact timeline. But I know at about 20 weeks, about halfway through the pregnancy, I basically messaged my doctor and I said, okay, I'm not doing good. This is not normal. I am throwing up all the time. I literally feel like I'm dying. I just feel like I don't know how I can do this for the remainder of the pregnancy. I'm so sick all the time. And everyone just tells me, yeah, that's morning sickness. That's normal. Yeah. Woo, pregnancy is so fun in kind of a lighthearted way. And I was really trying to express to everyone around me, no, this is serious. Like, I am seriously mentally not well. I'm seriously depressed. And I'm physically sick also. Skip ahead if you don't want to hear about this, but I'm going to talk in detail about my illness and how it affected me. So I started throwing up in public. I started throwing up in the restrooms of restaurants. and it wasn't always the cleanest ordeal. I started throwing up on myself, like while running out of a public place. One time my husband had to pull over the car on the side of the highway, and I just like barely made it out the door to throw up. One time I was with a friend and we were at a stoplight and I had to jump out and throw up. Basically what I'm trying to say is it wasn't just like, I have a little morning sickness. It was like everything I did, everywhere I went, I had to stop going places at all because I just got so sick and I was throwing up so much, and I stopped eating. Nothing sounded good. Everything made me queasy, and it just got to this point where like everything looked and sounded disgusting. And if you live in America, you'll just be driving down the road and there's a big old billboard with like a juicy burger on it. And to somebody who's suffering from hyperemesis gravidarum or any sort of like eating disorder or something that's going on with them, that is so disgusting. There's commercials all over social media. There's just food everywhere in your face. And I couldn't eat it. It was so disgusting. And at the same time, I knew I was responsible for a life inside of me. And so I had to eat because I needed to grow him. And it was so hard. I basically just got by eating what I could. I was not the healthiest, but I had to just eat what I could, or else I wouldn't be eating anything at all. So when I finally got to my breaking point and I messaged my doctor, because my doctor kept putting me off. She kept being like, yeah, it'll get better in the second trimester. Pregnancy, so fun. Haha, morning sickness, yay. And finally, I just said, no, enough is enough. I'm halfway through my pregnancy. I'm miserable. I'm very, very ill, to the point where like I'm considering going to the hospital because I'm so dehydrated. I'm so ill. I'm so sick that I just need something to change. So I went in, they did some blood work. They found, I was dehydrated, blah, blah, blah. And she finally looks at me and she says like, yeah, well, I think you have hyperemesis gravidarum. And that was so validating to me after going half of my pregnancy with no diagnosis. For her to finally listen to me and say like, okay, yeah, you're pretty abnormally ill and I'm going to finally help you. I have a lot of complaints about this doctor, and there was a lot of like hurt I harbored there, and I'll talk about that later. But like, she just wasn't listening to me. I felt so disregarded. And so I want to encourage you guys with any situation, if you're trying to communicate to your doctor and you know your body best, if you feel like something's wrong and you are not getting the help you feel like you need, then please do not give up and tell the doctor, express to them and say, no, something is wrong and I need a different treatment or a better treatment to help me. And she finally did help. And that is when she discussed putting me on home health. Up till now, she had been prescribing me different oral medications to help with nausea and vomiting. But when you're throwing up, you're not really, like, I could take the medication and then I would just vomit it back up. That's not helpful at all because the medication was not staying in my system. So at this point, when I went in, she discussed with me putting me on home health. And that's what happened. A nurse came out to my house. I did IV fluids at home, so I didn't have to go to the ER. I basically just sat at home. She connected an IV, and I was responsible for changing out the bags and maintaining my IV port site on my arm. So that was really weird because it was like, it was just really weird to be on an IV at home, and I had to change out the bags, and I had to learn a lot about how to be my own nurse, sort of, and my husband as well. They also put me on something called a Zofran pump, and it is a machine that you carry around in a little bag, and it connects through a wire subcutaneously, which means it goes into the fat on your body and is a continuous injection of medication. So I had these ports that I had to change out every couple of days, and I didn't like stabbing myself with them, so I had my husband do it. And every couple of days we would have to change out and put this subcutaneous port into a spot on my belly and then connect this pump. And so 24/7 for months, I had to carry a machine that was connected to, it kind of looks like a little IV bag, but it had medication in it that was continuously pumping medication into my skin that my body would then absorb, and it helped me. It really did. My vomiting episodes were a lot less, and I was finally able to eat some things. It didn't cure me, okay? I was still pretty sick, and also it's like exhausting to be connected to a medication pump all the time. But it helped me have some sort of quality of life, and it helped me keep some things down so that my son could grow. You know, I was pregnant. I was responsible for another life. I needed to eat. I needed to keep things down. And being so weak to the point where like I had to be on medication 24/7, being so sick for so long, so embarrassed all the time. It took a toll on me and made me feel, first of all, I didn't feel beautiful. I didn't feel like a beautiful, glowing pregnant lady. I felt sick. I felt dying. I felt just tapped out. And it just really was hard. It was hard because we live in a day and age where you can go online and check social media anytime and you see everyone, a day in the life as a 6 months pregnant person, and they just show like the cute perfection view of reality where you think that, oh, being pregnant is just like so cute and fun. You're glowing, you're baby shopping, everybody treats you so great. Well, what happens if you don't have that experience? What happens if you don't enjoy it? You don't feel beautiful, that you feel so sick and you feel so depressed that you like think, what have I done? Why did I even do this? Am I a bad mom before it even begins because I'm not enjoying growing my child and being pregnant? Everybody talks about, oh, it's just like so magical to be so close and they live inside you and you just have all this love for them. I felt none of that, sis. Like, I just felt sick and horrible. I felt no connection to what was growing inside of me. Nothing. I mean, if anything, I felt a little resentment, to be honest with you, because what was growing inside of me was making me so sick and just incapable to go about my day. So what happens then? Are you a failure? Are you not? These are the thoughts that are echoing in my head. I'm like, am I a failure? Am I just like not strong enough to be pregnant? Am I not strong enough to carry a child? And am I not strong enough to love this child? What the heck is wrong with me? Why don't I feel so excited and all this love? And the truth is, guys, the internet is fake as heck. It's as fake as they come. The reality is that pregnancy is really hard. You're lending your body and giving all that you have to growing another human being. It's exhausting. It will make you sick. Maybe not in the same way as me, but like most people have sickness. They have struggles. They have mental health issues. I had a lot of anxiety over something going wrong with the pregnancy. It was just like I had to face reality and understand that my perception and my expectations came from social media and TV, and that perception was not real. And it wasn't that I was a failure. It wasn't that I was weird or the only one experiencing things like this and the only one who didn't enjoy pregnancy. It was just that the loud majority of people online are just putting on a show. They're putting on the best versions of themselves. A lot of people online are trying to build social media platforms or make money even. And so obviously they're going to make things look fabulous because they want you to keep watching. They want you to be enamored by their life and their experiences. Which is why I just want to go in here and be real. Like, it was awful. Pregnancy sucked. I hated it, and I did not feel any bond to my baby. I made the decision mentally. I love him. I want him. I'm excited for the bond that will grow. But during pregnancy, I was like, I'm so ready to be done. I was grateful that my body was able to, although be very sick, but was able to be pregnant. That was a miracle. But then it was like the amount that I had to pay, the amount of pain, struggle, and hardship that I had to pay for that miracle, I questioned many days. I was like, is this even worth it? Like, I'm just going crazy here. So if you've been pregnant before and you've had an experience that wasn't so lovely and you thought, like, am I in the minority here? Like, why do I not enjoy pregnancy? I don't think you are. I don't think you are. I think that it's normal, and honestly, it's brave to be honest about it. And I understand that for a lot of people, their coping mechanism is to fake it till you make it and pretend like everything's peachy, and that helps their mind be more positive. That is great if that works for you. But just make sure that the things that you're sharing online, that you aren't knowingly being misleading, if that makes sense. that's just how it is, like, I don't know. You're not alone. If you've been pregnant before or you're pregnant now and it sucks, you're not alone. Pregnancy sucks. I hated it. It's awful. So that doesn't mean you're a bad mom, and it doesn't mean that you don't want your pregnancy, and it doesn't mean you're not grateful. It just means that pregnancy sucks, because it just freaking does. If you plan to be pregnant in the future, or you're trying for that, I don't want to scare you because, like, obviously what's on the other side is really worth it. But I want to encourage you that you are strong, you are a woman, you are powerful, and your body can create life. And even if you're in the place where that's not your story and you are going to grow your family in other ways, like adoption, like you are incredible, mama. The amount of love and dedication and just everything that goes into being a mom is inspiring. And I'm tearing up because I'm just like, man, I have a whole new appreciation for moms everywhere. Mom to mom in any way. What I'm trying to say is that if you're a mom in any way, like, holy cow, you're a superhero. And it's not easy. It's not easy. And I don't want to discourage anyone from that if that's what they want in their life. I want to encourage you and tell you that you can do it. You can make it. You can make it. In whatever way that happens for you, that your story is beautiful and it will be worth it in the end. So that's, I guess, what I have to say about pregnancy. And hopefully that wasn't like too depressing, or I also just like don't want to scare anyone or discourage anyone from that. I just want to be real. And I don't want you to go into it like me and have rose-colored glasses on and then be like slapped in the face, because I think that's a lot harder than being like a little bit more realistic about it and just knowing, hey, these next 9 months are going to be really difficult, but I can do it. I can get through it. And whatever is thrown at me, I'm going to overcome. So now I want to talk about what happened with my birth, my birth story. So my son was a month early, and here's how that happened. I had been getting a lot of anxiety. I was 35-ish weeks pregnant, so full term is 40 weeks, and I'd been getting a lot of anxiety over new symptoms. My belly at this point was getting larger, had a ton of stretch marks, and they were getting really itchy. And when I look up that symptom online, I had this huge scare oh my gosh, is it cholestasis? Cholestasis is a condition that can happen later on in pregnancy where your liver stops filtering as well. And so I guess like the blood that's going to your baby becomes sort of toxic in a way, and it can harm your baby and very seriously harm your baby. And obviously it's really scary when you start getting any symptoms that could be that. So when I started researching it, I was like, oh my gosh, is this why I've been so sick my whole pregnancy? Is this what's causing my hyperemesis? Because, side note, Hyperemesis gravidarum is a little bit of a non-diagnosis. Hyperemesis just means you're throwing up too much. I don't know what gravidarum means, but it's like one of those diagnoses that's like they have no idea what's wrong with you. They just like diagnose the symptoms and then symptom treat, but they don't know the cause and they don't know how to fix the root problem. It's just like you just symptom manage, if that makes sense. It's kind of like irritable bowel syndrome. Like, yeah, your bowels are irritated, but why? Like, you know? So super fun. And cholestasis, I was like, oh my gosh, is this what's causing me to be so sick and have hyperemesis? I don't know. Is there a connection? I just started going down a rabbit hole. So this same doctor, I went to her and I told her my fears and anxieties. She was very dismissive. Although the only thing you got to do to rule out cholestasis is a very simple blood draw. And I don't think that's that hard for a doctor to do. The doctor doesn't even perform it. The nurse does. So I don't understand. She kind of like treated me like I was just crazy for having these worries, when in reality, like, so much felt wrong with my pregnancy. I was super scared, like, oh my gosh, I need to make sure my baby's okay. We're getting to the end and I haven't been healthy, so I just want to make sure that he is. So I make an appointment. I make several appointments. I go in over the course of a week or two, interjecting here because I just want to make sure that I get all the details and I'm clear. I did not end up having cholestasis, and there was a lot of appointments back and forth ruling this out, doing the blood work. I even was considering going to the ER. There was an ultrasound that I did with this doctor where she was just like really weird, and she was quiet and vague and made comments about how my baby wasn't moving that much, and like she was like having me turn every which way to try to like wake him up. There was just like a lot of fear building at the end of my pregnancy, a lot of doctor's appointments, just a lot of like, I've been really sick, I have all these weird symptoms, my doctor was being weird. I honestly at this point had like lost all of my trust with her, and was just like honestly terrified that something was going wrong, and I didn't really know what to do about it, and it was just a really scary time. And eventually I have this really bad scare where I start getting pain. This is about 36 weeks pregnant. I remember literally like the night before I went in, we were walking around Walmart and I just was like, I can't even walk. Or at one point, I guess it was a contraction. I was like bent over my bed in pain, and maybe it was looking back, I don't know what it was, if it was Braxton Hicks. It just felt like cramping. I don't know. I didn't really feel like a contraction because it didn't like come and go. It was like steady pain for like a long time, if that makes sense. So I went in, told her about this. She asked if I was leaking any fluid, and I told her, I mean, not more than normal. This is a bit TMI, but like, there's a lot of fluid all through pregnancy. So I was like, I mean, no, not really. I said the other day, I kind of was like thinking maybe I peed a little. I don't know. Like that's been happening lately. Like you get to the end of the pregnancy and you're like, did I pee myself? I don't even know anymore. So she said, okay, well, we'll just test and make sure that it's not amniotic fluid leaking. She did a test in her office and was weird about it. And she said to me, her explanation was, oh, my tests are not like super accurate. This one is a bit inconclusive. So what I'm going to do for you today is I'm going to send you over to the hospital next door. They have a they have a better test that is more conclusive, that can definitely rule out that you're not leaking amniotic fluid. And I'm also going to set you up with a specialist to discuss if you should plan to deliver early and be induced early because of all of this illness and complications that you're having. The reason why the specialist came up was because as a regular gynecologist, I guess she wasn't allowed to make the decision to recommend that I would deliver early. Full term is considered 37 weeks, so it would be only a week from that appointment that I had went to. And the specialist would be able to make the call if they thought it was a good decision to go ahead and deliver early, just to be on the safer side and make sure that cholestasis doesn't develop. And I don't know, there was just like a lot, it felt like going wrong. And I just personally had a really bad sinking feeling constantly, like something was going wrong. And so the specialist was supposed to be the person that would make the call on whether or not we would move up my induction date to be at 37 weeks full term, which would be 3 weeks early still. And at that point, I'm like, I am 36 weeks pregnant. You are just now thinking about sending me to a specialist? Like, I should have been seeing a specialist from the moment I got diagnosed with hyperemesis gravidarum and from the moment I got put on a medical pump 24/7. Mind you, at this point, I'm still wearing the pump every day, injected medicine. And I'm like, she's just now thinking, oh, I should send her to a specialist. I'm just like, what the fuck? I don't know. I just feel so angry at how I didn't stand up for myself. Regardless, I've learned a lot of lessons. The reason why I didn't get a new doctor, if it's not, obvious, is like I was way too late at the end of the pregnancy. Getting a new doctor at that point would just be so exhausting for me. And it just felt pointless, I guess. Like I had honestly not only lost my trust in her as a doctor, but like the whole system. I don't know. So it felt like pointless at that point. I was too far along to find a whole new doctor, explain my whole history, and go through all of that, if that makes sense. But my recommendation to anyone watching here today is like, don't be me. If you feel uncomfortable with your doctor, and I definitely did, get a new doctor. Even if it's a little bit of a hassle, get a new doctor. Just get a different doctor, please. This is serious, and you need someone who's going to advocate for you and have your best interest. My husband was with me at this appointment this day, but the doctor's office was nearby my parents. I'm looking over here because I'm like recounting my memories. The doctor's office is nearby my parents' house, so my husband had a meeting with work that he needed to be at right after the appointment. So my idea was that we would go over to my parents' house right after the appointment, and he could work on his laptop over there, do his meeting, and then at his lunch break, we would drive back home. So we do that, we go over there, he sets up, blah, 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 and I say, okay, well, my mom will go with me to the hospital, labor and delivery, to get this test done and get whatever ruled out. And in my mind, because up till now, everybody was always dismissing me, telling me it's nothing. I had so many like blood tests and all these things. Everybody's like, it's nothing. You're fine. It's nothing. And I thought I would just go to the hospital. They would be like, oh yeah, you're good. Bye. I really thought that was how it was going to be. I go to the hospital, labor and delivery triage with my mom. We're waiting. My mom's joking. There's another person that in the room that has to go off to labor. And my mom's like, that's going to be you next. Like, she's just like, I don't know, kind of, that's just like my mom's personality. I wasn't really afraid. I was just like, oh my God, I hate the hospital. Like, why do I have to be here? Nobody likes the hospital. And if you know anything about emergency rooms or triage, like you're there a long time waiting for like nothing to be done. And most of the time they just tell you, go home. So they do the test. I'm waiting. Whatever, think it's nothing. I just really want to go home. I'm hooked up to fetal monitors. So they put one up here to monitor your contractions, and they put another one lower to monitor the baby's heart rate, and that is just continuously on the screen. So there's a lot of like noise. There's a lot of like just so much stimulation, and it's exhausting. Finally, the nurse comes in and says, "It tested positive. You are leaking." And I was like, "What? What? What?" My mom goes, "What does that mean?" And the nurse is like, "Yeah, your water is broken. You're leaking." So my mom said, "Okay, well, what does that mean? What do we do?" And the nurse was like, "Yeah, we're going to have to induce you." And my mom's like, "Today?" And the nurse is like, "Well, I mean, it'll take like 24 hours, but I mean, yeah, we're going to have to like admit you." And like, she was so casual about it, telling me at 36 weeks pregnant, a month early than I expected, "Oh yeah, we're just gonna induce you, you know, no big deal." I'm like, what the this is my first like child, and I was going in for a routine doctor's check today. What are you saying to me? And I just remember very distinctly my mom was like, "Oh, so she's gonna have the baby today?" And the nurse was like, "Well, I mean, like, not today, probably tomorrow." And I was like, "Okay, big difference." Like, just kind of whatever. Um so shock of my life. I called my husband. I'm like, "They said they're gonna induce me. My water is broke apparently. I'm leaking and they're gonna induce me. You need to come up here right now." So obviously he gets up there as soon as he can. And I'm just perplexed because I always thought when your water breaks, it's a big gush and you would know. I just had, listen, from the moment, I'm talking about the moment of conception. The moment of conception, I immediately just, there's so much fluid all the time. And like, there really wasn't a difference. The biggest concern to me was like the cramping I was having. So in my mind, I'm like, how long has my water been ruptured? Has it been days, weeks, hours? I don't even know at this point. So there's a lot of fear. It's like, how long have I been walking around with a ruptured amniotic sac? And okay, yeah, you don't want your fluids to get low to cushion and protect the baby, but when there's a leak, that also means that bacteria can get in, and so infections can occur and can make the baby sick. So it's a bad thing. As soon as your water is ruptured, it's not good, and that is why they wanted to induce, because I was close enough to term that they were like, "We're not going to do any like crazy." I think they can do something called a cerclage where they stitch your cervix shut or something to try to help if that happens a little bit earlier. But they were like, "No, we're just inducing." And that was crazy. That was crazy. I was not prepared. My hospital bags were not with me and they weren't packed. It was just insane. So they admit me. They put me in a room. My husband gets there. My parents go get our bags that are scattered everywhere. I mean, not even packed. Like, they had to come to my house and basically pack bags and bring them. We were just not prepared. I mean, it was a month early. What the heck? I guess I should have expected the unexpected, right? They put us in a room. They start to induce me. They put these things up your hoo-ha that is supposed to soften your cervix. I was 0 dilated at this point, just leaking amniotic fluid, and I wasn't having contractions at all. So they start to soften my cervix overnight. They also started giving me steroid injections, and this was to go ahead and like strengthen the baby's lungs because he was early. And so they were like giving him one last boost over that period of time where I was going to be laboring to I guess give him some strength and hopefully give him the best chance at being able to breathe without assistance and things like that. Let me just set up the timeline for you. This is May 25th, and it's kind of like afternoon, and they start to do the induction. At this point, I'm still vomiting. My mom went and got me my last meal, and I threw it all up. I'm still throwing up. It's just a good time. We go overnight with the cervix softening stuff, and at some point they transition over to giving me Pitocin. Pitocin is like where they just straight up give you the hormone oxytocin, and it is supposed to induce labor and start making contractions happen so that you get dilated and eventually birth a baby. Well, nothing happened. Like literally nothing happened. Okay. We got to the point 30 hours later, we're in this tiny room with no windows, hooked up to all these monitors. Every time I had to go to the bathroom, which was like every 10 minutes as a 3rd trimester pregnant lady, I had to like drag this IV and take all these monitors with me. It was just so mind numbing. Just that room was horrible. It was horrible. We got no sleep. There's just so much like noises. Yes, okay, the heartbeat of your baby is a comforting noise, but when you hear it for like 30 hours straight, just like boom, 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 you're like, I'm just losing it a little. I'm just losing it a little. And nothing was happening. I wasn't having contractions. The doctor kept coming in and checking if I was dilated. There was nothing. At one point, she like inserted something through my cervix to try to like open it up a little. Literally nothing happened, y'all. I was immune to Pitocin. They went all the way up to the maximum dose that they can give me, and nothing was happening. It was like so mind-blowing. And at that point, I'm like, yeah, figures, because my pregnancy has so not been typical, and it just figures that I'm just freaking immune to Pitocin. And this was a completely different doctor. So my original doctor that I had seen all throughout the pregnancy was actually on vacation that day. So I just had to have a backup on-call doctor. But maybe it was for the best that I just had a random person I didn't know. I liked her. I just didn't have any sort of relationship built up with her, and she didn't know my history. But I mean, she was nice. Honestly, I think it was for the best. I think I would have been way more anxious if I had the doctor that I had already built resentment for there treating me. So everything happens for a reason, I guess. Timing, I don't know. The turning point was when I kept trying to sleep and I would lay on my side, and then there would be weird heart rate dips with the heart rate monitor that was monitoring the baby. And the nurse would come in and be like, yeah, you can't lay on that side. He doesn't like it. And I'm like, okay. So I would turn, I would flip to the other side, I would close my eyes, and literally just as I was about to fall asleep, the nurse would come in and be like, yeah, he doesn't like that side either. And I'm like, all right, guess I'm not sleeping. So that was kind of the turning point where it just felt like, yeah, this isn't working. And obviously the baby isn't doing great either. There wasn't anything like emergent. It wasn't like his heart rate went super low. It was just like an indication that maybe he was a little unhappy. It was an indication that maybe something was starting to go wrong, and you just never know. I mean, we can't see inside, and you just don't know what's exactly going on. All we have to go off of is his heart rate. Maybe, I think actually I'm the one who brought it up. I was like, okay, is it time that we start discussing cesarean, a C-section? And this is where I get a little sad in this story. And this is where I still have some work to do with healing. I had just not prepared myself for alternate possibilities. Okay? That's my fault. I went into pregnancy with so many expectations and birth. And I had only prepared myself for one outcome, doing a natural birth. I wanted an epidural. Okay, trust me, y'all. I wanted that epidural. But just laboring, giving birth, I had just planned on it being normal. So to be honest with you, I had never once considered what would it be like if I had a cesarean. I don't know. I don't know why I didn't. And so when that happened, and it had been 30 hours and my body was not doing anything, I just felt really, really disappointed. Again. I've been disappointed through my whole pregnancy with my experience and just how much I didn't like it. And now all I wanted was to have a nice birth to make up for the horrific pregnancy. And yet again, I was disappointed and my body was not cooperating. So this is on the 26th. This is May 26th. This is like getting towards like maybe 6 or 7 p.m. The doctor had gone home for the day, but she was still watching. I guess she could on her computer at home or phone or whatever, watch my fetal monitoring. And she saw that the baby was having heart rate dips. And when the doctor came back to the hospital after going home for the day, I knew that it was time and I had to give up. And I had to do what was best for my son. When she came back up to the hospital, she just looked at me and was like, I'm not going to like tell you what you have to do because there's no emergency right now. He's just had like some minor heart rate dips. She was very nice. She was like, I'm not going to force you, but it's an option. And I do think it's a good option that you should consider. My heart sank. Because yet again, just something was not working out. And I was terrified. I had never had surgery before. And from the little information I knew about C-sections, I knew you're awake, you're splayed out in a cold operating room, and it's not the romantic, lovely birth that people dream about. But I discussed it with my husband. I even discussed it with my parents, and they all agreed that at this point, it just wasn't looking like labor was going to happen for me, and that I had to do what was best for my son. So that's what I did. That's what I chose. And there's nothing wrong. Even if you're a person who's like, I wanted a C-section from the beginning. There's nothing wrong with that. But for me, it was not something I had prepared for or considered. I wanted to labor. I wanted to labor. I wanted to like have that connection and fight for my baby. Like I just wanted to have that. And I didn't get it at all. I didn't labor at all. I watch TV and the internet now, and I just cannot relate to seeing women sitting there like laboring and being so excited and like passionate and pushing their baby out. I didn't get to have that experience. And honestly, I feel a little robbed and I feel sad because I really wanted it. I wanted something to work out in my favor. But that's okay. I had to be strong because that's what moms are. And as a mom, you have to make decisions sometimes. And you have to be strong and make decisions that hurt sometimes. So I made the decision to get a C-section. And once I did, things moved very quickly. Very quickly. They had us both like gowned up. They put on a hairnet. We were all ready to go, and they wheeled me into surgery. And they got everybody they needed, all of the staff, the anesthesiologist, the doctor, everybody was ready. We go in, and they're like, okay, this is gonna be quick. This is gonna take like 15 minutes, and you're gonna have a baby. And that was exciting. It was really exciting, but it was bizarre to like just skip laboring. Just skip it and just have a baby just cut out of you. It was bizarre. And so I expressed to them, I said, it's very important to me that I still get to do skin to skin right after he's born. I want to have that bond, and I want to have those first moments with him. And it's very important to me to do the skin to skin. They were like, yes, we'll do that. Don't worry. So we get into the C-section. They give me basically like a strong epidural that goes up to here and numbs you. So everything from like here down is numb. Your arms you still have feeling in, and like your face and your head, but like from here down you're numb. It even is like a little hard to breathe. Like it just feels like very heavy, and your whole body is just super numb. And it works fast, like boom. So I don't know how a regular epidural would be if you're laboring, but like this one in the surgical room, they like went into my spine, and it was just like it was like scary. I was like, did I just go paralyzed? Everything went numb immediately. They laid me back on the table. I laid my arms out to the side like this, and my husband is by my head. There is a curtain up in front of me, so obviously I can't see what they're doing, surgery wise. So they begin. Everybody's super casual in there. The doctors are literally talking about their college days, and I'm just laying there splayed open in a very bright operating room. And the number one question people always ask me, could you feel it? Because I'm awake. I'm awake during the surgery. And my answer is yes, actually. You can feel it. You don't feel pain, but you feel pressure. You feel pressure. It's kind of like if your foot's asleep, but you like press on it, you can kind of still feel it. Like I could feel my body rocking, and I could feel them literally like laying their tools down my legs, like they had obviously drapes and things over me, but I can feel them like laying out their tools over my legs, and I could feel it. And I'm laying there, and my face starts itching like really bad. Okay? I mean, it just will not stop. And I have a mask on, and my face is just like, I just want to claw at my face. I told the anesthesiologist this, and she said, okay, yeah, that's normal. That's just a side effect from the anesthesia. And I'm like, not the anesthesia, the epidural. And I'm like, that's really weird. But like, I just wanted to like scratch the skin off my face. And when you're like half numb, that's exhausting. That's hard. And I couldn't focus on maybe it helped me because my mind was just focused on my nose itching. I wasn't worried about being cut open. I just kind of disassociated to get through it. I just stared at the ceiling and just like zoned out, kept my eye on the prize, and knew I was going to meet my son soon. The anesthesiologist was kind of like up on my head, and she said, okay, they're about to take the baby out. Maybe the doctor said something. Somebody said, okay, you're going to feel some pressure. We're going to take the baby out now. And I could feel them like pulling him out. The anesthesiologist was like, okay, she had her hand on the curtain, and she was like, okay, they're going to hold him up for you to see him. She had her hand on the curtain, and then she was kind of like, oh, like you could tell something was wrong. Because why didn't they let me see him immediately? I was robbed of labor and delivery and like having my baby come out, immediately having him. Like I didn't have any of that. It was like they took him out. I didn't even get to see him. And they take him over to the side table where they kind of clean him up and weigh him and do all of that stuff, check his vitals. And I think I heard someone say something, oh, he's got a little bit of hypotonia. So that is where his arms and legs were limp and purple. There was just like not good muscle tone or blood flow to his limbs. And they were just kind of like limp and purple. He did cry. We did hear him cry. So that was a relief. And my husband the anesthesiologist tells my husband, okay, you can go over there now. And he goes over to the table, and he is with them. He has pictures. He got to see my son's first moments. So that's really cool for him. So I'm thinking, okay, they're gonna clean him up, do whatever, and then they're finally gonna let me see him and bring him over to me. I think at some point they wrap him up and they give him to my husband. And my husband comes over to the side of my head and kind of like shows him to me. Nobody in that whole operating room listened to me and let me do the skin to skin that I wanted. Nobody considered me. And I don't blame my husband for it. I mean, he was just following instructions and just doing what the doctor said. And he was, he was overwhelmed, and he was just like going where the doctor said to go. But none of the doctors, even though I had expressed to them, I had it in my birth preferences, like that I handed them, none of them ever they never considered me. I think why they didn't like show him over the curtain when he first came out is because of the hypotonia, and they needed to make sure he was okay. But after they were like, okay, he's okay, his his blood, his color's returning, he's okay. And after he cried, why did they not bring him to me and like put him in my chest? why? When they all assured me that that was what they were going to do. So my husband's holding him, shows him to me. He's kind of like crying and, you know, making weird noises. And I honestly, I could barely see him. I'm splayed out on a table and my head's like, I'm like turning, looking like this, like trying to see him. Somebody takes a picture of us in the like a quick like I'm just like looking awful. Maybe I can show it. I don't know if I feel confident enough in that. I barely see him, but I saw him. And then before I knew it, they escorted my husband out back to our room where my husband would sit and do skin to skin with him for the first time, and while they waited, and they closed me up and then brought me back to the room. That was it. That was all I got. After 8 months of carrying him and all of the struggle, I didn't even get to be a part of his very first moments. I'm afraid to say this because I don't want to hurt anyone who's also had a cesarean, but maybe you can relate to these feelings. I felt like I didn't give birth. Like I felt like I wasn't getting to give birth. Maybe to some people it's really nice to skip the pain and the labor and the contractions, but it felt like I was cheating and that I didn't give the opportunity to give birth to my son. Because in a C-section, he's just taken out of me. And there's no participation from me. They just cut me open and take him out of me because I couldn't give birth to him. C-section mamas, where you at? If you've had these feelings, how do you like get past them? Because I'm obviously still struggling with them. Like I know logically, I'm like, yeah, I gave birth, but I don't know, emotionally I just don't feel like it. I just haven't been able to wrap my head around it yet. There's still work to be done. Okay, there's still work to be done here. And I don't want you guys to think that all C-sections are this way if you are having to consider one or you know that you'll have to have one, because it's probably not. I was just failed by my doctor team and they just disregarded me and they didn't listen to me, and I was failed by them. And I don't think that's going to be the case everywhere. I think a lot of hospitals are very good about listening to their patients and advocating for them and accommodating their wishes when it's appropriate. I was just let down by my specific doctor team, and there's a happy ending to this, I promise. But I just need to express these feelings first to really feel like I've gotten out what I need to today. They closed me up. It took literally a few minutes, but those minutes were the longest minutes of my life. I was left alone, open, in an operating room. My husband nor my baby was there at this point. I was alone. After going through the hardest thing I've ever gone through, I was alone. There was no one to hold my hand. There was no one. It was just me, open on an operating table, listening to doctors talk about getting drunk in college or something. I don't know. It was just like casual small talk while I was going through the biggest moment of my entire life. So they close me up. They take me back to the room. And it's great. My husband had got to do skin to skin and just really be there for my son's first moments. And I'm really happy for that because a lot of men don't get to have those bonds, and a lot of men struggle with like having the connection, and I'm so happy my husband got to have that. Eventually I was I did get to hold my baby. I was still like numb and recovering and all of that, but I got to hold him, try to nurse him for the first time and do all of that. And so that was nice, obviously. But there was this like heartbreak inside of me from not getting those very first moments, I guess. We don't spend that long in the labor and delivery room before we're transferred to the new family unit, which is the postpartum room that you stay in after giving birth and to recover. Recovery for a C-section surgery, the insurance will pay for you to stay in the hospital up to 4 days. You can leave before it if you really want to, and your doctor discharges you and thinks that you're in good health enough to do so, but your insurance will pay for 4 days. So my son was born on May 26th, happy, healthy. He had a little bit of hypotonia, but it was getting better as the hours went on, and his color was returning and his muscle tone was returning. So nothing was wrong at that point. Everything was good. And we're like, okay, thank God, because he's early. He's premature. He was just a little small. He was born 6 pounds, 5 ounces. So he was pretty good size, even for being a month early. And everything was good so far. And we were good. And our plans were, we were just going to recover and figure things out and then go home. And as for me, I was fine too. The surgery went great medically, and my incision was great. Honestly, I wasn't really in that much pain. The only pain I experienced was when I did try to stand up out of bed or like sit on the toilet. Oh my God, that hurts so bad. Or if I laughed or coughed, that hurt. But like if I was just at rest and I was chilling, I wasn't trying to sit or stand, honestly, like I felt fine. They had me on a lot of medicine, but all things considered, like I really didn't experience that much pain. It was doable. Like I really think that, like, on the bright side, laboring and delivering vaginally might be more painful. For me, I don't know. I mean, I know everyone's different. Everyone's body is different. But, like, I think that pain-wise and recovery-wise, I think maybe the C-section was easier. I don't know. And everything is intact, down there. Everything. I just have an incision this big, and it's kind of, like, beneath your bikini line. I mean, it's really small. And everything was fine, besides just like some pain and some tiredness, but it was manageable. So the night goes on. We try to feed him. Immediately feeding was very difficult. He was so sleepy. I mean, because babies are already really sleepy when they're born, but because he was premature, he was just so sleepy. He would not wake up to feed. He was not interested. I wanted to breastfeed, and it was just like he was not getting it. I was frustrated. It was just like such a struggle. We ended up having to at first syringe donor milk into his mouth, like while he's sleeping, just to get him to eat, just like 5 milliliters, just constantly just trying to get him to eat. So we do that for a while, and then I keep trying to nurse, and then eventually I start pumping. When I start pumping, I think this was like the first night or the second night or something like that, I get a lot. And I just think this is like normal. I'm like, oh, wow, I didn't even know I was producing milk. Okay, like, a lot comes. And this is a blessing. Okay, a lot of women don't have this experience. So I want to give a caveat that this is not normal. This might be medication related. I'm not sure. So the first milk you get is like golden. It's colostrum. It's very different than your mature milk, and it came in a lot, and I didn't know what was normal until a nurse came in and was like, "You just pumped that?" And I was like, "Yeah, is that okay?" And she was like, "Oh my God, I'm gonna go have to get the other nurse and show them this." And I was like, "Okay, like, all right." And she was like, "That is a lot. That is insane." She was just going on and on about how like abnormal, how much milk I had just pumped for my first pump. She was like she was losing it. She was losing her mind. It was probably like 2 ounces. I don't know. I honestly don't know. It was like, but it was a lot. And she got the other nurse, and the other nurse was like, I've never seen anything like it. They were just going crazy about how much milk it was. And so at that point, it was kind of like a celebration. It was like a, yay, something finally is going well for me. My milk supply is great. Yay, this is great news. At that point, it was a little bit of a celebration. My son was sleepy, but we knew, okay, I can now give him my milk that I am expressing, and we can now syringe this to him while he's sleeping. So we were doing that, and the days and the nights continued. Syringing milk, me pumping, me having an oversupply, everybody going crazy at the hospital over I was like literally known as the milk girl. There's a thing that they do. They check baby's blood sugar after birth, and they come in and they stick their foot with like a needle, and they get a little bit of blood, and they put it in this little machine, and it comes back and it tells their blood sugar level. My son kept failing that, and they assured me, they're like, oh, this is okay, this happens, just give him a day or two, and they started giving him this like sugar concoction that they rubbed on the inside of his cheek to get his blood sugar up. So they would put this like gel in his mouth, and they just kept coming in every 3 hours. The hospital puts you on a schedule of feeding like every 3 hours, and they come in and they check his blood sugar, and it just kind of like it was such a blur. I'm also recovering from surgery, and it was just like they just keep coming in, he keeps failing, we keep struggling to feed him, and I'm just like, okay, what's happening here? So then they break the news to me, and they're like, okay, we can only do this amount of blood sugar tests before he has to be admitted to the NICU if he keeps failing them. And he kept failing, and they were like, okay, it's gotten to the point where, don't worry, this is just procedure. He has to go to the NICU now because he just keeps failing his blood sugar tests, and he's now going to need fluids and extra care at the NICU. At the point of the NICU transfer, I think it was overnight on the night of the 27th. So I had given birth on the evening of the 26th. We had about 24 hours with him in our room with us, and just doing all this feeding craziness and pumping and trying to breastfeed. And then I believe it was like sometime overnight at some point on the 27th, that is when he was transferred over to the NICU care specifically for his blood sugar. There was nothing else. The hypotonia, the limpness was fine. It was literally just the blood sugar problem. But they would not let him go without knowing for sure that he was able to get his blood sugar in the right ranges. Okay. That sucks, because up until now he was staying in our room with us, and the NICU, while yes, okay, it was close by, it was still down the hall and around the corner, and I just had a major abdominal surgery. I mean, I couldn't really walk that great. So they take my son to the NICU. He gets his own room there. It's really nice. He gets admitted, and I was shocked when I went to visit him for the first time. It was really, I was in pain. Standing up, sitting down, walking, it was pretty painful. To go in the NICU, you have to go through like a set of double doors, and you have to like page in and say who you are. It's like on lockdown, which is great because it's secure, but then you just feel so separated from your child, and you feel so far away, and it's I don't know, man. Having your child taken away from you right after birth like that is just honestly traumatizing. It was lovely. He got his own room. We were on this schedule every 3 hours. We were dedicated to going there for every feeding him, changing his diaper. We wanted to be responsible for him. Even though the NICU nurses would do it, we wanted to be there every time. We wanted to be there for him. Well, it finally caught up to us, and we were not sleeping. We were just like constantly going down there. We were doing triple feeds, okay? So what we would do is we would feed him with a syringe or a tiny bottle. Then I would try to get him to latch and breastfeed a little bit because we're still practicing that, and I still had hopes of that working out. Then I would pump. So we were like triple feeding, and then my husband would clean the pump parts, and then it would be time to do it all over again. There was no sleep. There was no rest. It was just like this endless loop, and it was exhausting. And he was hooked up to a lot of wires and machines, and to see a little tiny newborn precious baby naked, just in a diaper, and just connected to an EKG and IV in his hand, and like they're constantly pricking his foot and he's screaming, and it's you just hear beep beep beep, and then every time you you move him or hold him at all, there's these wires that are connected and they're all tangled, and you're just like trying to maneuver these wires and cuddle your newborn baby. And every time you hold him, the EKG moves a little bit and the alarms start going off, and it's just traumatic. My child only spent a total of 5 days in the NICU, but there are parents out there who have to spend months with their child in the NICU. And my heart explodes for you. Those 5 days were the longest, most confusing, most exhausting, scariest days of my life. And it was only 5 days. It was a humbling experience. And I obviously saw other parents there with other children. And man, I'll never forget. Anyone who has experienced that and come out on the other side, like, you are so powerful. You are so strong. You are so full of love and dedication. And then there's people who don't come out on the other side, and like, oh my God. I personally just don't have the words except for I'm sorry. We had high hopes. We were like, it's okay. I mean, honestly, this is great. Like, he was a whole month early, and the only thing that we're struggling with is his blood sugar, and they're assuring me that it will even out. He will wake up, he will start eating better, and it will get better. They were assuring me that it's okay. Everything is okay. And honestly, I was just counting my blessings that he was there and he was otherwise healthy and good, and you know, we were really keeping our head up and just exhausted and trying really hard, and we were just like, we were just there for him, and we were just fighting for him, and just like waiting for him to start passing those glucose tests. Days go by, almost a week goes by, and he's still failing. Nothing's changing. They have him on an IV. They're giving him all these fluids. Failing. And I'm like, what now? Like, I hit this wall where I was like, nothing's changing. We're just doing the same thing over and over and expecting different results. And I'm losing it. I'm so tired of walking down to this damn NICU, seeing my child connected to all these wires, hearing all these alarms. It's just like, I just want to go home. This is too much. What do we do? How do we fix this? How do we actually make him start passing his tests? What do we do? I'm lost. And nobody was saying anything. We just kept doing the same thing, losing our minds. It was literally this like loop. I felt like I was in Groundhog Day, and I was in this loop. Days go by, and I'm like, what? Hello? Is anything going to change here? Me and my husband really broke down at a certain point. We're just like, what's happening? We're in this endless loop, and this cannot continue to go on forever, right? Eventually, I discussed with the pediatrician at the NICU. We start kind of supplementing with formula into his breast milk and like calorie boosting. And eventually he did start passing his tests. Not by a lot, but like he had the bare minimum to where they were like, okay, we might be able to discharge him soon. I said insurance would pay for me to stay in the hospital 4 days. So 4 days had gone by and I was getting discharged, and we're like, oh no, we don't want to leave here without our son. That is when stuff really hit the fan and got really hard, because I suddenly had to face the idea I might have to leave this hospital without my son. And that is really, really sad. Graciously, the NICU had what they call a bonding room. And it is essentially just like a bedroom. It had a queen size bed in it, and it's set up like a little hotel room, and it's a bedroom that they let families stay in when their child is very close, like a day out from being discharged from the NICU, so that those families can get an experience rooming in with their baby and taking care of their baby overnight and kind of getting on their feet before the NICU sends them off to be on their own. Because you have to keep in mind, a lot of families have to go through the NICU for months. And so then when they're finally like about to be sent home with this child, they're kind of like, what do we do? And you need a little bit of an adjustment. So they have this bonding room. They let us stay in it. So I was there for 1 night at labor and delivery. Then 4 nights had gone by. Just me staying, recovering from the C-section. And honestly, I was doing great. My C-section was recovering great. I was getting around good. Everything was going great. And so they were literally just keeping me that long because he was there. So eventually they were like, sorry, you have to go. We have to discharge you. So 5 days. The NICU gives us the bonding room. And that is, he is a patient. He is admitted to the hospital, but I was discharged, and we were just allowed to like stay and sleep in that room as parents and, stay in the bonding room. So we do that. He gets to be unplugged from everything, and he comes and he stays with us in the bonding room. And this is going to be the 6th night, I believe. And I'm so excited. Okay, this sounds so stupid, but it's the very first time we got to put clothes on him. Okay, we got to put a onesie on him for the first time ever after 6 days of his life. And I put this little outfit. It was way too big on him, but it's the smallest one I had. And I just remember feeling such joy, being like, finally, we get our son back without cables. He is in our arms. We get to spend the night with him in a little bassinet next to us. And we just get to have an uninterrupted night where the nurses are outside if we need anything, and they do still have to come in, test, and do the things with him, but he's with us, and we're in the home stretch now. Or so I thought. The hyperemesis at this point had completely gone away. As soon as I gave birth, I did not get nauseous again. I was ravenous. I was so hungry, so thirsty. When they came with my crappy plate of hospital food, I wolfed that down. I was like starving, because I hadn't been eating for the longest time. And then now that the hyperemesis had lifted, it was crazy. It was just like miraculous. I suddenly could eat again, and I would eat. I was so excited to eat, but I couldn't eat enough or drink enough to keep up with the milk coming in, and it didn't matter. I still had that deficit from being sick for so long. It was going to take a little bit more time to fill up that deficit. Not to mention, I don't think we slept more than like 5 hours all week, like combined. Not a night. Combined. There was no sleep. You do not sleep in the hospital. There's somebody coming in every 10 minutes needing something. And yeah, I was very sleep deprived, and I had a deficit of nutrients like no other. At this point, this is the 6th day, my mature milk started coming in, and it came in hot and heavy. I mean, I was pumping like 8 to 10 ounces in a session, like less than a week postpartum. I mean, it just came in really intensely, which is great. However, I was not in a healthy state before with the hyperemesis and not eating, losing a lot of weight, being really sick. I was not in a healthy state. And then now when you breastfeed and you pump, it takes so much nutrients out of you. So now it was taking even more nutrients that I barely even had out of me. Okay, my body, it started to shut down. And I'm not even saying that in an exaggeration type of way. I would pump and I literally started to like lose consciousness while pumping or shortly after pumping. But I was doing it for my son, to have milk for him, and I had a whole freezer full at this point, even at the hospital. And I had to continue pumping because if I didn't, there is a big risk for infection. You can get clogged ducts, or your milk supply could like diminish. In those early days, it's very important, if you choose to breastfeed, to either breastfeed, which wasn't happening for us, or be pumping consistently so that you're continuously removing milk and you're not getting an infection. And it freaking hurts, okay? I didn't have the choice. Like, it freaking hurt. You've got to get it out, because I think, or else I would have exploded. So I didn't, even though pumping was making me feel sick, I also couldn't stop. Sorry, I just need to clarify so much, because in editing this, I'm like, I just want to make sure that I'm super clear and I don't give anyone the wrong impression who might be experiencing these things in the future. It's really horrible. It's a horrible feeling to feel like there is something that you're doing that's making you feel really sick, but you have to also keep doing it so that you don't get sicker. It's very confusing. The joys of parenthood, so fun. I spiked a really high fever. My body started like shaking uncontrollably. And I told my husband, I think you need to get help. Thankfully, we were already at the hospital, so like getting help was really easy. If we were at home, we would have had to call an ambulance, because I started crashing. I started losing consciousness. I was like not even able to speak. We call the triage line and ask them what to do, where to go in the hospital. Like, do I have to go to the ER? Because I was discharged. They said that I can go back to labor and delivery and get readmitted from there. So I go back to where we started, labor and delivery triage. The NICU nurses, they were so sweet. They had to get a wheelchair and wheel me over there. They take me there, and they do not know what the heck is wrong with me. They're like, okay, what? They thought I might have been septic, which is where I think your like organs start to shut down. And I was scared it was a complication with surgery. There was an infection in my surgical area or something. And I think they were concerned about that too. And I was like, I was like, they're going to have to open me back up. Oh my God. They're going to have to open me back up. What do I do? What do I do? What do I do? What do I do? And the unfortunate part was, we were 6 days in. That day, my son was getting discharged. And I'm like, oh my God, we were literally right about to go home. And then I got readmitted because I started crashing, and they didn't know what was wrong with me. They didn't know what was wrong with me. They could not give me an answer. They were like, we don't know. So they just started me on a bunch of antibiotics. They were like, whatever you got going on, whatever infection you have, one of these antibiotics will cure it. They send my breast milk off for some cultures. They send my urine off. They send my blood off. They send everything off for cultures to see like what's wrong, what kind of infection I have. And in the meantime, because cultures take time to come back, they just gave so many antibiotics. So I'm like, crap. Now my son is going to leave without me, and I'm going to be here in the hospital. What do we do? NICU was so kind, so gracious, and they let us stay in the bonding room another night. So this would be the 7th night. And that was the hardest. The 6th and 7th night when I got readmitted was the hardest 2 days thus far, because I we were at the end and my son was okay. And then I was like, this is my fault now that we're stuck here. I was crashing again. The 6th night when I was readmitted, they put me in this like tiny room that did not have room for my husband and my baby to stay with me. And I was hysterical. And at this point, my husband wasn't with me. I had to call my mom to come back and be with me because my son was getting discharged. And so I was like, you need to go be with him. I mean, you need to be with him and make sure that we see it through and that he gets discharged. Okay, he is my priority, even though I was like dying. I was literally dying, blacking out. Terrified. I thought I was dying. I really thought I was dying. I thought it was the end. My mom came in, she was standing beside me when when they were still checking me and I was like blacking out and still had the really high fever. And I just remember staring at the ceiling and the corners were going black. I mean, I thought to myself, like, this might be the end. Something seriously wrong might have happened with my surgery and this might be it. And I was terrified. And I told my husband, I said, my biggest wish right now, I know you want to be here for me, but you need to go be with our son. He is a little baby, fresh into the world. And you need to see it through and be there for him. Like, that's what I want. I want you to leave me and be there for him. So my husband left me alone in the emergency. And my mom came up to the hospital to be with me. And I was like hysterical from being taken away from my baby yet freaking again. I just got him back and I was taken away from him again. And they gave me morphine and they had to sedate me so that I would sleep because I was like hysterical. They literally had to sedate me. And so they did, and I slept a little. The nurses were so nice and went to meet me at the bonding room to do my care. So I was on IV and I had, I was readmitted. I had to have a lot of nurses come in and do my care and administer my medicine and do my vital checks and all of that. They made the effort to come to me at the NICU, even though that wasn't their floor. I mean, we're on the same floor, but that wasn't their area. So these are postpartum nurses who are taking care of postpartum moms, but they would come all the way down to the NICU, go through the locked doors, and come care for me in the bonding room so that I could go back and be with my family. So I wasn't separated for long. I was able to go back and be with my husband and our son, and they accommodated that. So that I'm so grateful for. And this is one of the examples of the nurses like really going above and beyond, and just I will just never forget their kindness and them going out of their way to do that for me, and the NICU for allowing us to stay in this room because it was a free complimentary room. They could have, I don't know what the situation was, that there was no other families, I guess, who needed it more. And so it was just lucky that we got to stay in it a second time, and they were just like so accommodating and so understanding that we were going through it. So, yeah. At one point, I was having really bad heart palpitations even. I was like half asleep, and I don't know if anyone's experienced this, but it was kind of scary. I honestly thought, am I having a stroke? Am I having a heart attack? I don't know. But I was like half asleep, and then I had this sensation in my head like I was somersaulting. It oh my God, I can't even explain it. It was like this pulsing and this sensation that meant my brain understood that my body was going like this, somersaulting, but I was laying in a bed. And so logically I knew I was laying there, but like I just had this physical sensation and this pressure and this boo boo boo. It was, I still to this day, I don't know what that was. I ended up having to do an EKG, and they did some kind of blood test where they could determine if I was having heart attack activity. And they ruled that out, and everything came back normal with my heart. So I don't quite know what that was about. But I mean, obviously something was wrong. My body was not good. It was scary. Little by little, I did get better. My fever broke, and they never could figure out what was wrong with me while I was in the hospital. They were giving me a bunch of antibiotics through IV. Something was working. I was feeling better. I was feeling stronger. And little by little, I felt better. My doctor was like, this is my original doctor. She was like, well, you have to be fever free for 48 hours before I send you home. And I said, no, ma'am. Like, I'm sorry. I want to leave. Okay. I haven't had a fever for almost 24 hours at this point. I need to go. I've been at this hospital for a week and it wasn't even planned. I need to go. I need to go home. It was freaking miserable. We barely even had stuff there that whole week. My parents had to constantly go to Walmart and get us stuff. We were just not prepared. I mean, certainly not prepared for a week. And I just said, no, I want to go home. So eventually I convinced her. She let me leave, sent me home with a bunch of antibiotics, went home, and we finally made it out of there. Yay. So you may be wondering, okay, what happened? What was wrong with me? I'm still sort of wondering that myself. They came back and they said they thought I had mastitis, but not in a typical presentation. It was more so like my milk came in really intensely and my breasts were like starting to get infected, and then like I was pumping and emptying them, so I was kind of like keeping it under control, but it was mainly just my milk supply was too much too fast. It was just drawing way too much nutrients and energy out of me, and I also had a really severe urinary tract infection, and there was just a whole slew of like issues. My body just wasn't doing well, and there was nothing serious other than that. There was no complications with my surgery. It was just like recovering, not sleeping, having an incredible oversupply of milk, and coming off of having hyperemesis and being really like dehydrated and malnourished. It just caused my body to like go into shock and go into, oh my God, overdrive mode. Honestly, the best cure for that would be to just go home. Get some rest. Stop being bothered by all these nurses. They come in like every 30 minutes. They're great. They're doing their jobs, but like, oh my God, it is impossible to rest and sleep in the hospital. Impossible. It is horrible. At the end of the day, we made it, and it was a really horrible experience in that spending unexpectedly going to the hospital a month before you thought you were going to, and then spending a week there with like so many complications and random things going wrong. It just was not my idea of fun. And there's so many details of the nurses and just moments where me and my husband just truly broke down, and there were so many ups and downs while there. But at the end of the day, we made it. My son was okay. I was okay eventually. We just needed to rest and go home and just be a family and move on and figure out what our new life looks like. And so eventually we got to go home and just start our new life as a family and begin recovering. And this is now where I'm going to talk about now, postpartum and breastfeeding, and how incredibly rewarding but difficult that has been. So as I expressed earlier, the C-section, it was really difficult mentally for me, and everything that went wrong, the trauma of like having my baby go to the NICU and then being taken away from him again and readmitted, and I had to literally be sedated, and there was just like a lot of trauma that came along with it. And then there was a lot of disappointment in the birth itself. I didn't get to have a beautiful experience. It was just like a surgical, sterile removing of my child, and then I got to see him like 30 minutes later. It was just not what I had pictured or dreamed of. And so when I got home, I really struggled to bond with him. I really struggled. I knew that I was making the decision to love him. I mean, obviously we had been through a lot, and we were like there for him in the NICU. Every couple hours we went down to that NICU, and we were there for every feeding and diaper change. We were taking responsibility. This is our child. We're going to take care of him. And I was making the decision to love him. And obviously I'm like, oh, cute baby. Like, I love him. But I wasn't in love with him when I got home. I just wasn't. And that's the honest truth, you guys. Like, it doesn't always come immediately. I know that people online will be like, oh my God, it was love at first sight. I just love this little baby. I've never felt so complete than when I saw their face and blah, blah, blah. I think for a lot of women, you look at this baby and you're just like, I don't know you. You're screaming constantly. I'm exhausted. They don't give you anything. They don't smile at you. When you come home with a newborn, they just scream, poop, and eat. They're just very like needy little potatoes that you're trying to keep alive, but they're not really giving you anything back. There's no affection, there's no smiling, there's no interaction. They're just like these demanding little potatoes. And it was really hard for me, at least, to look at my son and feel like, oh, I just love you. I'm so in love with you. It was more like okay, I'm choosing to love you. You are my son. I will do anything it takes. But like something is just missing. I just don't feel that immediate connection. I just don't know you. It was very frustrating. He would cry and I'm like, I don't know what he wants. Like, I don't know what's going on. In those early days, breastfeeding was really hard. He wasn't latching good. My milk was coming in so strong. I was constantly in pain. Nobody prepared me for that. Nobody told me that once your milk comes in, it was a very painful process. Your boobs are rock hard. They're engorged. They're leaking. It's just miserable. And you're constantly just like fighting with a little potato trying to feed them, and they don't want it. You're not having fun. And you're like, why am I doing this? Like, what am I doing? Why am I doing this? What is going on? And mentally, when you are breastfeeding and you're doing it so often and you're on this schedule every couple hours, just constantly feeding, pumping, cleaning parts, you just feel like your only purpose is to be a cow. I mean, that's how I felt. I'm sure a lot of women can relate to this who have had a breastfeeding journey, whether it was 1 week or 1 year. At a certain point, you just feel like, dang, I feel like my only purpose is just being milked, and you just start to feel your humanity slip away. It's just exhausting, but then you like fight and continue to do it because you feel like you're doing what's best for your baby. And this is why I do not blame anybody for switching to formula. Like, you made a very brave decision in doing that, and you made the decision that was best for, whether it was for medical reasons for your baby or if it was like just for your own mental health. You go, girl, because I really strongly considered it as well. And I was like, this is really hard. And nobody truly prepared me for it. I even took classes and I still wasn't prepared for it. You just aren't prepared for what it's like until you're in the situation. And we made it. I mean, I'm still going. I'm still breastfeeding my child, and I'm very grateful for that. And it's gotten easier, but there's definitely still some days and nights where I'm just like, I don't want to do this anymore. I'm so exhausted and I feel like a cow. But I mean, we do it because we love them. You know? And I'm sorry, but in those moments, I didn't just feel like a tremendous amount of love and affection. I just didn't. I have a journal entry from when he was 2 months old. He's 3 months now, okay? He was 2 months old, and I wrote in there, I just don't feel it. I feel exhausted. I'm choosing to love him, but I just don't feel it. I'm just not feeling the magic. And I talked to my therapist about this, and I'm like, is there something wrong? Am I having postpartum depression? And she explained to me, yeah, I mean, it's possible, like, and it's okay. You had a lot of trauma, and postpartum depression is very real, and you have to be mindful of that. But also, it's very normal to not have a connection right away. And I'm like, well, I see all these other women who just talk about love at first sight, and they just feel so motherly immediately. And I just thought, what's wrong with me for not having that? I never had it all through pregnancy, and I don't have it now, postpartum. And she said, maybe it's a little bit of like a fake it till you make it type of thing, where they're going through the motions and they're telling themselves, oh, I'm so in love. I love this baby so much, until it comes, until it gets real, until that feeling actually feels real. It's kind of like you're like getting your mind in the right place, and you're like willing it to be, if that makes sense. And I was like, yeah, maybe. Because like, I don't know. And since then, women I've talked to, it isn't always immediate to have this bond. And especially after what I went through, and I didn't get to have a labor. I didn't get to have skin to skin. It was like I was in survival mode. And then when I finally got home, was able to have those moments with my son, I was just like, I feel like I've already missed it. I feel like I've already missed out on so much. And I just feel like the opportunity has just missed me to really bond with this baby. I'm happy to say it gets better. And I know everyone says that, and it's so cliche to say, but it gets better. It gets better. The days are so long, but they go by so fast. Before you know it, months have gone by, and you feel like you feel like you're in the swing of things. You know what you're doing. You change a diaper like it's nothing. You breastfeeding, it's, we both got it down. He knows what to do. I know what to do. My supply has evened out. And this didn't happen in the blink of an eye. It just happened slowly. And then before you know it, you look back and you're like, hey, I think I'm starting to figure this thing out. Each day they become less and less of a potato. They start smiling at you. They start like interacting with the world around them. They start looking around. They start doing these goofy little things that fill you with so much joy. And it's in those moments that you find a bond and your love grows for your baby. And that, my friends, I think is normal, okay? It takes time to get to know people. And when your child comes out of you, even though they're a part of you, like you feel like, yes, they're a part of me, and I very much would do anything for them. But the bond you share, that really incredible mother-son bond, parent-child bond, that grows over time. Each of those little moments, the time when they let out a fart so loud that it just seems so inhumanly possible for such a small little person, that you just like laugh and you're like, what is my life? Or when they give you that first gummy smile because you were talking to them, and they're just like, the first time they kind of realize, oh my gosh, like I'm alive and there's things around me. The first time they hold on to something and discover, oh my God, I have hands. Or right now my son is discovering his tongue, and so he goes around all day like sticking his tongue out. You just find the joy in those little moments, and those happen slowly, day by day. They learn new things. You just build that connection and that bond over time, and that is normal. It's also normal to feel it immediately, and that's okay. Like if you feel love at first sight, good for you. I'm so happy for you. That's amazing. But if it takes time for you and it's not immediate, there's nothing wrong with you. You're not broken. It doesn't mean it's never going to come. You're certainly not a messed up person if you're like, what have I done? I hate this. After you give birth, you come home with a angry, screaming, pooping, crazy potato. You're like, this isn't very fun. Why did I do this? Normal, y'all. Totally normal. And it genuinely does get better. And soon before you know it, you're 3 months in, like I am sitting here now, and you look back at all of that hardship, all of the times your heart was broken, all of the times I was sick, sick. All of the times I thought there is something wrong with me. I am not feeling it. I am not excited. I don't know what I'm doing. All of those times I just felt so lost and like I was drowning. I'm now 3 months into it, and I look back and it's fading. These things that were so big, so painful to me in the moment, so scary, so insurmountable. I thought I wasn't going to make it through these things. 3 months into it now, looking back, it's starting to fade, which is why I wanted to sit down and make this video today, because I don't want to forget. I don't want to forget what I went through, because damn, I have so much respect for myself. Damn. I will never again let anyone treat me like I am weak, because I am strong. I just went through it. I went through so much, and I understand that it could have been worse. There could have been so much more to happen to me, but I went through something very difficult, emotionally, physically, all of it, financially. It's a whole nother thing. I went through it, and here I am on the other side, and I'm okay. I made it. Every day I'm filled with new joys, getting to build this new life with my son and my husband and my 2 little doggies. And it's fading. It's fading to be a scar that's healing. It's still a scar. I will never forget what I went through. I will never forget how hard pregnancy was. I will never forget how hard it was to be so sick. I will never forget the trauma and the shock and the disappointment I had in the hospital with birth, and the fear of having my baby in the NICU and taken away from me. I will never forget what it was like seeing my helpless son connected to 7 different wires and not being able to hold him like a normal baby, not being able to put clothes on him until a week into his life, and hearing alarms sound every time I just tried to hold him. I will never forget. Those things are seared into my brain. However, they do scar over, and they stop bleeding. Those wounds stop bleeding, they scar over, and in time, you're able to just look back and think, yeah, I made it. So that's my story, guys. Very long. And it's okay. If nobody watches this, it's okay. I'm going to watch this. In the future, when I feel discouraged or I feel like I'm weak, I'm going to watch this. And I'm going to know I am a mom. I am a hero. I am going to hold on to my story and know that I made it on the other side. I'm better for it. I'm stronger for it. Postpartum is really hard, and it's hard to get used to your new body and your new life. I still am not sleeping through the night. My son gets up 3 times in the night still sometimes. My hair is all falling out. My body is to flab. It's just flabbing everywhere. But I'm okay. And I'm more confident in a way in myself and my abilities and my strength. And so I'm going to watch this later and know that I am a powerful kick-ass woman that can do anything. So, thank you guys for listening to my story. Hopefully that helps encourage you. If you're in the thick of it now, it will get better, and you are strong, and always advocate for yourself. Also, try to speak up and let doctors know exactly what you need from them. Hopefully your experiences are better than mine. And just know that it's completely normal if you're just going through the motions and pregnancy is not fun, you hate it, or postpartum, you're like, I don't even like it and I don't feel a connection with my baby. Totally normal. Keep going. You are strong, and just look forward to those little moments that will make it worth it. I promise you, when your child smiles at you for the first time, it makes everything melt away. And you will start to form that bond. Now, He's my best friend. He is my little buddy. I love him. I've been sitting here. My husband's been watching him for over an hour now, and I hear him crying, and I'm like, oh my God, I miss him so much. Like, I love him with my whole heart, and I do feel the bond, and I know it will only grow. So, hope that was some encouragement. Otherwise, it just gives you a peek into who I am, and you guys can understand me better. And I'm just sharing a piece of my heart with you, and I think it was good for me to just recount, because I don't want it to fade to the point where I don't remember, because I want to remember. I want to look at the scars of my life and remember and feel and appreciate being alive and appreciate those hardships, because I know that it only made the joy on the other side that much better. You guys take care. I hope you're doing well. And just know, if you're a mom or you have a mom, everybody, just know, like, damn, mom's my hero. And I'm rooting for you. I'm rooting for you. And I believe in you. All right. I will talk to you guys soon. I'll be back with some less sad stuff, and we'll resume crafty content. But thanks for allowing me space to share myself. I hope you have a good one. Bye.